Well, the big focus on the show today is the genomic sequencing of the positive cases of coronavirus and whether India is doing enough of it. Now, genome sequencing by the Indian SARS-CoV-2 consortium on genomics has shown recently that India has variants of concern and a novel variant as well. That means a new variant. Analysis of tests has detected a novel variant of SARS-CoV in Maharashtra with double mutations. Now, the emergence of the new variants of coronavirus have set off alarm bells, but the government claims there is no evidence yet that the new variants are leading to the surge in cases that we're seeing, and experts are divided on this issue. But the question is, do we have enough information? The scale of genome sequencing in India has been dismal. According to reports quoting an unnamed ministry source in magazine Down to Earth, only 7,664 samples, that's less than 1% of the total positive samples since January 2021 through March 18th, 2021 have been sequenced so far. So it's less than 1%, and earlier reports have also said that it's less than 1%. Compare this with the United Kingdom, which has done a genome analysis of 5% of their COVID positive cases, and they identified that Kent variant last year. Well, to explain this to us, we're joined by Brigadier Dr. Arvind Lal, Chairman FICCI Swasth Bharat Task Force, and Executive Chairman Dr. Lal PathLabs, and Dr. Geetha Vani Rayasam, Senior Principal Scientist and Head Science Communication at the CSIR. Thank you so much both for joining us. And Dr. Geetha, first to you, the question that many experts are raising is that we're not doing enough genomic sequencing in the country, and that's the reason that we don't know yet whether these variants are the cause of the rise in cases.
Yeah, so I think when it comes to sequencing or any of these, what you need is the data, and more the data, better is the confidence. Having said that, I think we are able to detect the mutations, and you are seeing the data which has been released recently, that we are being able to detect the variants. And so I think whatever we are doing, it has not stopped us from detecting the variants. Of course, more can be done. And I think it depends on each state. For example, in Kerala, where CSIR is doing it, we have already sequenced more than 2,000 sequences. I think it is state by state, the variation is there, perhaps. But nonetheless, I think what we are doing has given us evidence that there are variants of concern in the country.
Right, Dr. Lal, what would you say on this issue? And also, there's a group of labs, specialized labs only, that are doing this genomic sequencing. If you could tell us about that.
Yeah. So the first thing, first of all, thank you very much for getting me on the show. The fact of the matter is that normal labs and normal doctors are not really concerned or involved with this sequencing of the virus. And the reason is that our workload in normal, times goes up and down. Right now, as you know, since there's been a surge, so this is out of the purview of normal labs. So the government has quite correctly set up 10 national labs that are doing the analysis of the variants and the genomic analysis. And the figures which I have are that 10,787 odd samples, positive samples, which were sent by the states and the union territories. About 771 variants have been, found out by these 10 labs. So, which is not a small number. And since, you were concerned that with UK, etc., I don't know their numbers, but this is not a small number. So, 736 UK variants, which we call B1.1.7, have been found out, and 34 from South Africa, and one odd from Brazil. And the point is that in Maharashtra also we have found 2 now mutations or variants which we are following very closely. So the news which has reached us, and mind you, we are not the scientists involved in
right, of course,
sequencing. So the news here is that, well, they may be infective, but they are not that virulent. So these are the first reports which have come to us. So I think I would like to stop at that. It's just speculation right now.
Right, you're absolutely right. There's anecdotal evidence that we're getting from doctors in Maharashtra who say that, while it's spreading faster, it does seem that, the illness is lesser, that the duration is lesser. But of course, we need, proper analysis, proper study to draw any sort of conclusions on that. And Dr. Geetha, so, it sounds very scary to the layman when they hear that there's this double mutant virus that has been, seen or found to be there in Maharashtra. But when will we know about, more about it, whether it's more infectious, whether it causes a worse illness, or whether it's able to the other worries, of course, about the vaccine. So when will we know?
Yeah, I think first of all, mutation is a very common thing. I think there's nothing to worry because as the virus is spreading, more and more people are infected. It is a very common thing in nature that viruses mutate, bacteria mutate. So it's a very common thing. So nothing to be really worried because it's a part of the evolutionary process. And yes, we have found double mutants, and these two mutations have been reported in the Brazilian variant separately and in the South African variant, and so on and so forth. So it is a concern, but not alarming. I think that is important to note. And importantly, we do not yet have evidence to say that these are highly infectious or these are avoiding the vaccines. So I think we need more data to say that for sure. And I think we will get data perhaps in the next month or 2 months. I do not know. As the infection progresses, and if we see that there is a surge in infections, and actually the people who are infected are actually infected by this variant, only then we can say that this variant perhaps is leading to the increase in the viral infections. Because now the increase in cases could be a variety of reasons, like, lack of social distancing and masks. So we don't have data as of now to correlate and say that it is this double mutation which is triggering the
absolutely. And people have really become lax in the last couple of months, especially at the start of the year when cases went down. And finally, Dr. Lal, I just want to, it's been a year since the coronavirus lockdown when all of us were shocked by this pandemic, by this disease. And since then, India's seen massive strides in terms of, testing, RT-PCR testing, etc., etc. If you could just talk a bit about that.
Yes, I would like to say that first of all, as far as testing was concerned, India rose to the occasion. And we have now more than 2,000 plus labs, out of which 60% are private labs. And to start with, we less than 5 labs when we started. So I think kudos, we can pat ourselves on the back that whatever has happened, whichever way the pandemic has gone, no pandemic goes the way you want it to go. So obviously there will be surges, there will be dips, there will be increases, etc., etc. But as far as the pathology labs are concerned, they have come out with flying colors. Because if you do not detect, if you do not test, you can't track, and if you do not track, you cannot isolate and quarantine. Right. So whatever the people may say, the unlocking has had a negative effect, as you know, but we cannot go back to the locking process. So in my opinion, what we should be doing is all the 3 or 4 things, that is keep wearing your mask, maintain your social distancing, and hand wash, etc. Right. And with that, do not give up on vaccination. There is a myth going around in certain quarters, including educated people, that the vaccination is not good. I would like to say on your channel that without vaccination and the first 3 or 4 things which I said, you cannot lick the virus. So it is in our interest to get very large numbers of people vaccinated as quickly as we can.
All right. Well, thank you so much both for joining us on the show and talking about, the strides that we made, and hopefully soon we will be able to ramp up the genomic sequencing as well and answer all those questions. Well, it's time now for our viewer question segment, and Dr. Geetha is with us to answer those questions. Let's just listen into the first one.
So my name is Nitin Anand. I am from Patna, Bihar. My college is Delhi School of Journalism, Delhi University. My concern is that how the vaccination hesitancy has affected the vaccination process, and what are the steps that government is taking towards reduce the vaccination hesitancy.
Right, doctor?
Yeah. So I think there is no reason to be hesitant about the vaccine. I echo the previous expert. So I think, and we are seeing that now more and more people are becoming eligible for the vaccines, and now lakhs and lakhs of people have taken the vaccine. Perhaps early in the vaccine campaign, there were some concerns because it was very new, but now we have ample data to show that it is safe. And I think I request everybody to take the vaccine. And I think all our doctors and Honorable PM himself, they have shown by example by taking the vaccine. And I think there is no reason to be hesitant about vaccine. And I think whoever is eligible, we should take it. And I think that is one protection which we are fortunate enough to have it. And I think we should take the vaccine. That would be my appeal to everyone who is watching this show. Please do take the vaccine.
Right, and with the Prime Minister and many celebrities and Chief Ministers taking it, it's been a confidence booster in the vaccine. Let's listen to the next question.
Hello everyone, this is Sean from SRM University, Chennai. My question to the people in the panel is, do you think the vaccine that are administered currently to the public is sufficient to eradicate the spread of COVID-19 virus for good?
Doctor?
Yeah, so I think it's a good question. You know, eradication is something which is going to be long term, and I think vaccination is definitely a step towards that. But I think as we take vaccination, we should not stop social distancing and this, because we do not have yet data that if you are vaccinated, you are protected, but are you still infectious to others? That data we do not have. So I think it's important that apart from vaccine, even after taking the vaccine, please do wear the mask and avoid as much as crowds as, because it's not a passport that you can go and, you know, mingle with everybody, because others may not be vaccinated and still you may still give the virus to them. So I think we need to follow vaccination and social appropriate behavior, social distancing. I think with only those things we can eradicate the vaccine. I think there is no single magic bullet. I think it's sheer hard work. We need to follow the social distancing and vaccine.
All right. Well, thank you so much, Dr. Geetha, for joining us on the show today.
Thank you.
Well, let's now focus on Germany, where German Chancellor Angela Merkel surprised Germans on Wednesday when she apologized for mistakes related to the management of the coronavirus pandemic. Merkel had previously announced a strict lockdown over the Easter holidays, but after previously unannounced emergency talks on Wednesday and widespread criticism, she surprisingly overturned the decision. Well, for more on that, we're joined from Berlin by DW political correspondent Thomas Sparrow. Thomas, it is certainly surprising to see the German Chancellor reverse a decision on such short notice and ask for forgiveness. What's the background?
Well, after marathon talks on Monday in the Chancellery, 12 hours long and well into the night, Merkel had announced a slightly stricter lockdown over the Easter holidays, all that to discourage travel and social contact with churches, asked to hold their services online, public gatherings prohibited, and almost all shops closed during those 5 days. But after strong criticism, even from within her own ranks, both at the measures and the style of leadership, Angela Merkel surprised everyone in Germany on Wednesday with a reversal and an apology, stressing that the idea of a stricter Easter shutdown was difficult to implement in such short notice, saying the mistake was hers alone and recognizing that it was causing additional uncertainty among Germans. Her statement on Wednesday was remarkable. It will probably go down as one of her most memorable and difficult ones in her 15 years as German Chancellor, and it will probably also be mentioned as part of her legacy at a time when Germans are preparing to elect her successor in only 6 months.
All right, that U-turn was quite a surprise. Well, with all this, concern over the COVID spread, the vaccination, however, is progressing slowly. Why is that?
More than 11 million vaccine doses have been administered in Germany, and this means that over 9% of Germans have received at least one dose, and over 4% are now fully vaccinated. This is slow compared to other countries both inside the EU and outside the bloc. Part of the problem is definitely related to delivery issues at the wider European level, but Germany's rollout has also been badly affected by bureaucracy, by lagging digitalization, by organizational issues, and that's why leaders met last week in a so-called vaccination summit to try and speed things up. And part of the strategy will involve including GPs and family doctors in the whole process as of April, so that they can vaccinate their own patients. As of now, vaccinations mainly took place in big centralized centers. And officials hope that this will help give the rollout not only speed, but also flexibility.
All right, Thomas, thanks so much for joining us here on the show with the latest from Germany. Well, with that, time for us to slip into a short break. On the other side, we'll take a look at COVID numbers and spikes in certain states. Welcome back. Well, let's now take a look at the COVID numbers. In India today has reported 59,118 cases in the last 24 hours. This is the highest number that we've reported since the 19th of October last year. So even yesterday we reported over 50,000 cases. We've reported 257 deaths in this last 24 hours as well. So the total number of deaths is 1,60,949. And as you can see, the states which are the most problematic are it's in the south there, all the south states, and you also have Maharashtra as one of the states that's reporting the maximum number of cases. So let's just take a look at the state-wise breakup, and these are the top 5 states that have reported the maximum number of cases in the last 24 hours. And of course, Maharashtra still at the top of that list with 35,952 cases, which is the highest that they've ever reported in a 24-hour period, followed by Punjab, Karnataka, Chhattisgarh and Kerala. So these states actually overtaking Kerala. Remember, Kerala was the big worry earlier, but Kerala numbers, while they were coming down steadily, they've started going up again. But Punjab, Karnataka and Chhattisgarh now worry, reporting over 2,000 cases, 2,500 in fact, for Punjab reporting 2,661. If we take a look at the number of deaths in the last 24 hours, well, Maharashtra again with 111 deaths, followed by Punjab with 43 deaths, Chhattisgarh, Kerala and then Tamil Nadu. So that's a big worry with the number of deaths also increasing over the last couple of days. So let's just take a look at the curve for Maharashtra, and there you can see how it's been rising over the last couple of days. In fact, it's reporting more cases than it was in the peak of its crisis last year. So Maharashtra really a big worry, and measures have been announced there. Gujarat also is seeing an active rise in the number of cases being reported there. In Uttar Pradesh as well, and that's the worry this time around in what's being called the second wave of coronavirus, is that a lot of cases are being reported in towns, in smaller, in more rural areas, and we're seeing cases going up in some states that weren't the worry earlier, and Kerala as well. As you can see there, cases going up. So let's just take a look at the Kerala curve and how it has it was going down steadily over the last couple of days, but now you can see the curve is rising here once again. So that is the big worry with Kerala right now. And if we take a look at some of the other states, as we said, if we take a look at Gujarat right now, and there as well, you can see just how steep the peak is. It was coming down steadily in February, but since March, it has been rising steadily. It may not be as much as it's been in Maharashtra, but definitely a big peak there, and the cases are rising up steadily in Gujarat. So some of these states are the ones that are a worry, UP and Gujarat and Chhattisgarh, that are seeing a rise, a spike in the number of cases being reported every day. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.